Hi, this Screenomatic video is going to be regarding a client that has come in who's a 40-year-old male with a Pitta Prakriti. Oh, this is for the week 4 discussion, by the way. A 40-year-old male with the Pitta Prakriti. He has moderate amma and has recently been diagnosed with a fatty liver. So the main points that we're going to talk about today are going to be regarding the fatty liver, what the causes, the symptoms, and what other future recommendations for this client are going to be. I don't have a PowerPoint put together. I'm just going to talk a little bit about the fatty liver and what that's all about. So this patient has a fatty liver that's not associated with alcoholism. It's actually pretty common worldwide for this, and it is strongly associated with people that have sometimes diabetes, insulin resistance diabetes, or are obese or overweight. It is a part of the metabolic syndrome, so especially people that have centripetal obesity or fat that's contained mainly in their midsection area are more likely to have this, which is the non-alcoholic fatty liver. And this really means that the cells of the liver have changed due to excessive use and inflammation, and this can then lead to much more serious things such as hepatocellular injury and fibrosis as well. So with the non-alcoholic fatty liver disease, there's a lot of different risk factors, inflammation, IBS, viruses, cystic fibrosis, a lot of different things can actually lead to that, along with the, not that, that can complicate the non-alcoholic fatty liver. So basically, the non-alcoholic fatty liver disease can be caused because of excessive triglycerides in the liver, insulin resistance, which can alter the uptake and the synthesis of the free fatty acids that are in the body. And then also I had mentioned inflammation. So really, can then progress to liver damage, which can result from an oxidative state of stress and inflammation with inflammatory cytokines actually in the body. So the symptoms of non-alcoholic fatty liver are going to be, sometimes it's actually symptom-free. There might not be really any symptoms that can be detected. It might just be that they're on a test that it's an elevated liver enzyme. Some patients can present with fatigue, just coming in being tired, saying that they can't even, walk up a flight of stairs anymore. They're just kind of getting winded, or by the end of the day, they just want to totally rest. They don't even want to do anything else. Also, sometimes there can be right upper quadrant pain or abdominal discomfort, and that's actually where the liver is located. So there's actually some physical pain that's going on with that. Another symptom can be hepatomegaly, which means a larger than normal liver. Megaly, the liver is enlarged, and you can sometimes even feel that when touching the patient, when touching the client. Also, some other things that is going to show progression of this disease would be ascites, cirrhosis, splenomegaly. Splenomegaly is when the spleen is also enlarged as well. Hard liver borders, if you're touching the liver and it just feels like a rock. People can present with jaundice, meaning that they have yellowing of the eyes and skin because of the excessive bilirubin that the liver can't properly process out of the body. And also they could have metabolic syndrome. So the patient's probably going to appear and present to you being overweight, having some maybe diabetic issues or insulin resistance issues, and then also have some of these other things that we had talked about. So metabolic syndrome, let me just mention that really briefly, is when someone has certain parameters. So they have impaired glucose tolerance, meaning that their fasting blood sugar is going to be over 110 milligrams per deciliter. Their hypertension is going to be over 130 over 85. You're going to have elevated triglycerides, meaning over 250 milligrams per deciliter. High density lipoproteins, which is going to be really less than 40 milligrams for men or less than 50 milligrams for ladies. And then also presenting with that abdominal obesity that I had mentioned, that centripetal obesity, in which the waist is going to be greater than 40 inches for men or greater than 35 inches for females. So treatment. So with modern science, the treatment can be weight reduction, of course, calorie reduction, exercise, really getting the patient to move while treating the insulin resistance and the diabetes. In Ayurveda, it's seen that the non-alcoholic fatty liver is really can be treated via Amapachana, Agnidipana, Virechana, castor oil soaked with raisins, and 1 teaspoon of triphala as well, if the patient is weak. You can also give them different things. If they're having a lack of appetite, you can give them Live 52 from Himalaya, and that can increase the digestion of their meals. MA 579 or liver balance before meals if there's a lack of appetite as well. And with Veda 2523 with 15 milliliters of water. And when Nirma, you can give the Rasayana MA 325 for pitta and nourishment of 1 to 2 teaspoons at bedtime. And this is going to be great for this client because he has the pitta prakriti. So what my recommendations for this client are going to be what I had just mentioned, especially the Rasayana MA 325 because of his pitta prakriti. Okay, thank you. Bye.